I have mentioned in my other videos that I often scroll through social media to learn what is said online about breast cancer surgery. My aim is to support or refute comments made on the internet based on currently available research data, combined with my own experience as a breast surgeon. I feel strongly that women should know the evidence that may influence their decision regarding breast cancer surgery, and therefore have dedicated this channel to this purpose. In a few of my other videos, I indicated that I have come across comments made by another breast surgeon who was treated for breast cancer herself that startled me. What did she say? She made the rather shocking statement that she wished that as a breast surgeon, she was aware of all the collateral damage that breast cancer surgery can give. It is both a surprising and sad notion. I have therefore produced a series of videos, including this one, to help women who are in the process of deciding on breast cancer surgery, and hopefully the express disappointment of this breast surgeon can be avoided. To help women with breast cancer make a decision about their surgical treatment. In this video, I will share facts about the potential for collateral damage, with a focus on surgical complications. There are more than 5 issues that both surgeon and patient should be aware of, and I will be talking about them through this video. I will summarize these concerns at the end of the video, so you may wish to stay until the end. One of my main goals for my patients is to minimize the possibility of collateral damage. In order to do so, we would need first to provide context. Breast cancer surgery may be broadly classified into 2 groups of operations. Breast conservation treatment forms the first surgical group. This involves surgery to completely remove the cancer with a rim of normal tissue around, and it is usually accompanied with radiotherapy to the preserved breast. This procedure is also known as breast-conserving surgery, lumpectomy, segmental mastectomy, or partial mastectomy. The other group of procedures fall under mastectomy, which is the surgical removal of the breast. Patients may elect to undergo reconstruction after. If you have been diagnosed with early-stage breast cancer, and your surgeon has offered you the option of whether to undergo breast conservation surgery or mastectomy, you may wish to take note of this joint statement by a panel of experts who convened at the 2025 edition of the St. Gallen International Breast Cancer Conference. They believe that patients should be advised that breast-conserving surgery, or BCS for short, and radiation therapy is usually the best treatment option. Having said that, we now move specifically to deal with the subject at hand. The breast surgeon we referred to earlier had a mastectomy with implant reconstruction as her primary surgical treatment, which will be the focus of our discussion in this video. The data presented in my other videos have already alluded to the fact that mastectomy and implant reconstruction is associated with higher surgical complication rates than breast conservation treatment. In addition, there are studies published in 2026 on implant reconstruction that report complication rates of between 25.4 and 65.5%. Let us now look at what kind of complications a patient might encounter after undergoing mastectomy with implant reconstruction. This is a list of acute complications observed by Dr. Kwa and her colleagues from Australia. We will discuss each surgical complication and how this team of doctors managed them. The first group of complications which were encountered was skin loss. This is medically termed skin necrosis. While there were no pictures depicting such an event after surgery in this particular article, I searched out others to help women understand how the problem may manifest. Here is an illustration of mastectomy flap necrosis in a patient with previous radiation. The skin changes would appear similar even in the absence of radiation. Therefore, should a patient notice such skin changes, she should see her surgeon as soon as possible. If these skin issues occur, how are they treated? Where the problem is minor, they may be treated with careful wound dressings, which may need to be changed several times until the skin heals. For more serious situations, there may be a need for surgical debridement, which is an operation to remove unhealthy skin. If this is inadequate, the surgeon may perform more extensive surgery like flap advancement. there may be a need to remove the implant. In some cases, the implant may be replaced. In the most dire of instances, conversion to autologous reconstruction may be used. There may also be wound dehiscence, where the surgical wound breaks down. Treatment for this is similar to that for skin loss. It is also possible that tissue fluid collects around the implant persistently after drains have been removed. This is medically termed a seroma. Most of the time, this can be treated with removal of the fluid using an injection needle, referred to as aspiration. However, in severe cases, it may require surgery with implant removal and revision of the reconstruction. If there is serious bleeding, there may be a need to return to the operating theater to stop the bleeding. Implant infection may also require surgery to remove the implant, and a second operation later to reinsert a new one. More commonly, patients may encounter implant rotation and early capsular contracture, which may also require surgery to correct. We have gone through the potential acute complications with mastectomy and reconstruction. Here are the delayed complications experienced by patients in this study conducted in Australia. There are several, but I wish to highlight just the issue of recurrence. Like the surgeon who inspired this video, of the 55 patients in this study, one experienced a recurrence. So mastectomy does not guarantee the absence of a recurrence. Many women have said to me that they thought that a mastectomy will leave them with nothing to worry about, and they assume that surgery is straightforward and that they will not have recurrence in the breast. As demonstrated in this study, this is not true. So to summarize, these are the complications which may be encountered after mastectomy with implant reconstruction. As mentioned earlier, there are more than 5 potential issues which may occur after surgery. Reviewing just the long-term complications encountered by patients in this study, which were treated by a second operative procedure, we note that revision surgical procedures were performed in 50 breasts. Considering that this study included a total of 95 breast surgical procedures, having encountered issues requiring surgery in 50 breasts, it would mean that 52.6% of operations required some form of corrective operative revisions in the long term. This means that more than half of the patients who had mastectomy and implant reconstruction encountered surgical complications. The natural question to ask would be if this report is unusual. As a comparison, in 2026, the same year of publication, another research group from the University of Texas MD Anderson Cancer Center independently reported that, of women who underwent breast implant reconstructions, the cumulative incidence or total occurrence of postoperative complications was 63%. In this separate 2026 study from Italy, the researchers reported that of women who underwent breast implant reconstruction, 56.3% of patients experienced no complications. This therefore means that 43.7% of women encountered complications. Having reviewed these studies, the data demonstrates that overall complication rates of more than 40% are not unusual. It is my hope that this presentation has given you insight into the issues which may arise with breast cancer surgery, in particular mastectomy with implant reconstruction, which this surgeon underwent as her primary surgical treatment. If you need to make a decision for breast cancer surgical treatment, hopefully this knowledge will empower you to choose yours with clarity. Thank you for staying until the end of the video. If you have found this information useful, kindly like, share, and subscribe. All references for the studies discussed are available for you to verify, and I encourage you to do so. The links for my other videos covering related subjects are listed in the description below. I hope you will join me in these videos too. Should you have any questions about the articles presented in these videos, please leave a comment or submit a request at the Just Medicine website, the link to which is also included below. I will do my best to address them. Until we come together again, take care.